PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 പരീക്ഷാ സഹായി ഉറപ്പായും പഠിക്കേണ്ട ചോദ്യങ്ങളുമായിട്ടാണ് ഈ വീഡിയോ ഉൾപ്പെടുത്തിയിരിക്കുന്നത്. ഈ വീഡിയോയിൽ മെഡിക്കൽ സർജിക്കൽ ക്വസ്റ്റ്യൻസ് ഉൾപ്പെടുത്തിയിരിക്കുന്നു. ഇതിൻ്റെ പല പാർട്ടുകളും മുമ്പിലത്തെ വീഡിയോകളിൽ ഉൾപ്പെടുത്തിയിട്ടുണ്ട്, അത് കാണാൻ ശ്രമിക്കുക. കൂടാതെ തുടർന്നുള്ള വീഡിയോകളും ശ്രദ്ധിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. നന്നായി പഠിക്കാൻ ശ്രമിക്കുക. നമുക്ക് ഇന്നത്തെ വീഡിയോയിലേക്ക് കടക്കാം. The common factor of puerperal sepsis, scarlet fever, Orchitis media, bacterial endocarditis, rheumatic fever and glomerular nephritis. Is that all? Result from streptococcal infections that enter via the upper respiratory tract. Results from streptococcal infections that enter via the upper respiratory tract. Diet prescribed for haemorrhoids in acute exacerbation. Low roughage diet. Treatment with hemodialysis is ordered for a client and external shunt is created. Which nursing action would be highest priority with regard to the external shunt? Avoid taking blood pressure measurements or blood samples from the affected arm. A client with acute renal failure complains of tingling of the fingers and toes and muscle twitching. This is caused by calcium depletion. Accidental removal of parathyroid during thyroidectomy result in tetany. After prostate surgery, the retention catheter is secured to the patient's leg, causing slight traction to the inflatable balloon against the prostatic fossa. This is done to. After prostate surgery, the retention catheter is secured to the patient's leg, causing slight traction to the inflatable balloon against the prostatic fossa. This is done to provide hemostasis. Client is experiencing tachycardia, decreased blood pressure and decreased peripheral pulses. These manifestations suggest client experiencing tachycardia, decreased blood pressure and decreased peripheral pulses. These manifestations suggest cardiogenic shock. In TNM staging, N represents lymph node involvement. Which conditions is an early symptom commonly seen in myasthenia gravis? Which condition is an early symptom commonly seen in myasthenia gravis? Ptosis. When developing a plan of care for patient with gouty arthritis, which action would have highest priority? When developing a plan of care for patient with gouty arthritis, which action would have the highest priority? Ensure an intake of at least 3000 ml of fluid per day. Ensure an intake of at least 3000 ml of fluid per day. Medication which is used to apply on the scalp for treating pediculosis capitis. Lindane. A nurse is monitoring an adult male patient 8 hours after road traffic accident. Which findings by a nurse suggest increasing intracranial pressure? The patient is oriented when aroused from sleep and fall asleep immediately. When batch pattern is otherwise named as Mobitz type 2. Mobitz type 2. During the time of any infection, what will happen to the WBC count? Increased. Nurse is monitoring an adult male patient 8 hours after road traffic accident. Which findings by a nurse suggest increasing intracranial pressure? The patient is oriented when aroused from sleep and fall asleep immediately. Following cataract surgery of a patient, the nurse should advise the patient to avoid vigorous brushing of teeth and hair. Which hormone from the thyroid gland participates in calcium regulation? Calcitonin. Plaster of Paris is most commonly used material for immobilization of fractures. Chemically, the plaster of Paris is calcium phosphate. Which medicine is discontinued 12 hours before CABG intervention? Digoxin. Most common site of lymph node enlargement in Hodgkin's lymphoma is cervical. Weng patch pattern is otherwise named as Mobitz type 2. The most common complication of mumps infection in adult man is Orchitis. BRCA1 mutation is associated with which cancer? Breast cancer. Early sign of CA colon. Sudden constipation. To prevent a systemic absorption of eye medication. The nurse should hold side pressure on the lacrimal sac for 1 to 3 minutes. The plasma membrane in the body allows some substance to pass through it while excluding others. This type of barrier is termed as the plasma membrane in the body allows some substance to pass through it while excluding others. This type of barrier is termed as selective permeability. Selective permeability. Early sign of bladder cancer. Painless hematuria. Diffusion of water from a hypertonic solution into hypertonic solution across and selectively permeable membrane is referred as diffusion of water from a hypotonic solution into hypertonic solution across and selectively permeable membrane is referred as osmosis. Intracapsular cataract extraction means removal of cataract lens plus capsule. Removal of cataract lens and capsule. At which level of carbon monoxide patient may be comatose? More than 50%. A nurse Liana is aware that early adaptation of client with renal carcinoma is intermittent hematuria. Immediate management of choice to restore BP and peripheral circulation is dash. Immediate management of choice to restore BP and peripheral circulation is dash. Ringer lactate. Ringer lactate. Priority intervention in a heart failure patient secondary to dilated cardiomyopathy is primary intervention in a heart failure patient secondary to dilated cardiomyopathy is dash. Check response to prescribed medications. Priority intervention in a heart failure patient secondary to dilated cardiomyopathy is dash. Check response to prescribed medications. Respiratory control centers are located in dash. Medulla and pons. Which piece of information from the client's history does the nurse identify as a risk factor for developing osteoporosis? The client dash receives long-term steroid therapy. Pain at McBurney point is an important symptom of appendicitis. Diffusion of water from a hypotonic solution into hypertonic solution across and selectively permeable membrane is referred as osmosis. An emphysema patient can receive oxygen at a flow rate of 2 liters per minute. What is the earliest manifestation of autonomic dysreflexia? Throbbing headache. Causative organism of scabies. Sarcoptes scapi. Which condition is common as strep throat? Acute pharyngitis. A nurse is monitoring an adult male patient 8 hours after a road traffic accident. Which findings by a nurse suggest increasing intracranial pressure? What is expected to occur for patient with Addison's disease? What is expected to occur for patient with Addison's disease? Hypotension. Hypotension. The pathology report states that a client's urinary calculus is composed of uric acid. The nurse should instruct the client to avoid organ meats and extracts. Following laminectomy, a client is experiencing frequent voiding of small amounts of urine. The problem is experienced by the patient is dash. Urinary incontinence. The liver takes up glucose, convert it and store it in the form of dash. Glycogen. To promote post-burn hydration. To promote post-burn hydration and kidney function, the nurse should keep accurate intake and output, wait daily, and maintain IV fluids. When caring for a client with a diagnosis of Cushing syndrome, the nurse understands that the excessive amounts of glucocorticoids and mineralocorticoids will increase the client's dash. When caring for a client with a diagnosis of Cushing syndrome, the nurse understands that the excessive amounts of glucocorticoids and mineralocorticoids will increase the crisis of dash. blood glucose. Blood glucose. Glomerulonephritis patient complaining thirst. The nurse should offer. Glomerulonephritis patient is complaining of thirst. The nurse should offer hard candy. Hard candy.
താങ്ക്സ് ഫോർ വാച്ചിങ്. PSC നേഴ്സിൻ്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC നേഴ്സ് എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.